Hey everyone, it's Dr. Solomon at UnPhiltered. Welcome back to our podcast. Today we're going to be doing part 2 of a longevity series with Dr. Melissa Hirshberg. Okay, next topic. I feel like we're doing like rapid topics because each of these topics we could make a separate podcast on. It's like this whole podcast dedicated to basically each topic we're touching on today. So next topic I want to do sort of a rapid fire, just get your sort of summary impression of is IV therapy. So a lot of our clinics, aesthetic clinics, are offering IV therapy. I know that you do at your clinic. Mm-hmm. Tell us sort of your thoughts on it and what are the commonest ones, and if there's any sort of some science behind it as well. So IV, vitamins, IV, whatever other solutions you're offering.
So at Wellness House, we do IV therapies, and we're quite busy doing them, and people seem to love them. In terms of the science behind them, there's not great evidence, unless you have a true deficiency, that you're going to derive a benefit from doing IV vitamin therapy. And I tell that explicitly to patients when they come and ask me, should I be doing this? That being said, people seem to feel better. And I don't necessarily see a harm in it. And if it's something that you can do to feel better, then sure.
You don't think it's psychological at all?
I always say that the placebo effect is 30%, right? So yes, it may be psychological. I also think hydration is huge.
Well, that's true.
So many people are dehydrated.
So it could be saline and you could feel just as good?
Yeah, it's like I did this thing recently. I saw this thing recently that said the solution to anything is salt and water.
Yeah.
Right? It's like the ocean, a good cry.
I agree with that. That's great. I like that.
And what you're getting in the IV vitamin therapy, the basis of it is salt and water, plus the other vitamins in it. And some people are, especially people that are on these weight loss medications that may not be eating enough and that are dehydrated. They often say a lot of the fatigue that people feel on them can be from dehydration. So there's a benefit from that. The other...
what about glutathione and NAD and things like that?
So again, these are kind of... if you look at Peter Attia, he's not going to recommend them yet because there's just not enough evidence really that the theory behind them is good. If you look at NAD, the theory that it increases mitochondria and that's our cell's energy warehouse. So it's good. The thing is we just don't know if that really translates to a longevity benefit. So it's not one of the first things that I say, you guys should do this. But if someone comes in and they're interested in it, we do offer it and we have the IV. And if people are scared of IV, we also just have injection, which is easier to use.
Would you not agree that based on your patient population, the patients who are doing, say, IV therapy, glutathione, NAD, who are doing anti-aging paradigms, aesthetic treatments, possibly weight loss regimens, that they overall look way healthier than patients who do nothing?
Well, you're also selecting for a population that's interested in that, that's caring about their health. So yeah, they do. I actually see both, okay? So I see that some patients who aren't necessarily taking the best care of themselves from a lifestyle point of view, so they might be drinking too much, maybe they're smoking or vaping, maybe they're doing drugs, and they use this as a bit of a, is this going to reverse what I did in my lifestyle? So then no, then it's, don't be fooled.
The people who really buy in, because we see it in surgery. The patients who are doing a lot, say, who get a facelift, for instance, or even their eyes done or fat grafting, their surgical outcomes are clearly better than the patients who aren't taking care of themselves.
You're going to get way better healing, So
it does have an impact.
Oh yeah.
It just makes you believe in this stuff. Kind of when you're seeing it all sort of on a sample size of your own practice of thousands of patients over many, many years, we see like again and again and again, patients who take care of themselves, do diet, exercise, workout, and buy into some of the anti-aging paradigm tend to look better, but they also tend to heal way better.
I would totally agree.
But that's coming from the inside out. They're eating well.
It's hard to say that it's all just this. It's the whole picture of everything.
Yeah. I would agree. One question I was going to ask you. So, for the patients that are on the GLP-1s, yes, they have to stop them. How many weeks before anesthetic typically?
It used to be over a month, and then it came down to we do 2 weeks, I think, in our clinic.
Okay.
Initially, it was like a significant anesthetic risk because there were apparently a patient in the United States who died from an anesthetic, and it was due to aspiration.
Right? Yeah.
And so they presumed it was related to the Ozempic. And it seemed to come down, like the anesthetic guidelines seemed to modify it over the years. So it was sort of like COVID. During COVID, there were all sorts of like rules and regulations relating to giving an anesthetic, mask, like everything in medicine gets extreme and then it sort of gets dialed back a little bit. I felt like with Ozempic, it definitely came out. There was a lot of chatter about it and talk amongst medical professionals, surgeons and anesthesiologists, and then it seemed to get dialed back a lot over the last, I'd say, year.
Do you notice the one thing I think about with patients is, a big concern also is like, if you want to age, I always tell people, if you want to age great, keep your muscle, keep your collagen. Because
how do we do that? How do we keep
that
collagen?
Your muscle and you got to keep your collagen.
It's the collagen that we see is the battle in our clinics. So
yeah, and I was going to ask, the one thing I wonder about with patients on GLP-1s, are they going to lose
more collagen?
More collagen.
Yeah.
Because that's what and again, I always, like for me personally, I'm not on GLP-1, but I do take good care to try to stay lean through, diet and, fitness. And collagen is one of those things, like it's a guaranteed, as you age, you're going to lose collagen.
Okay, we're going to talk briefly about Ozempic face. So Ozempic face is a terminology that's come out after Ozempic was implemented. Patients were noticing significant body composition changes and losing weight. And we were seeing patients in the office with early or premature aging. So the question is, how much of it is the Ozempic causing possible collagen changes, or how much is it due to weight loss and rapid weight loss? So we had seen many, many patients for many, many years coming pre-Ozempic with early premature aging, needing facelifts in, say, their 30s and 40s. But usually they'd undergone gastric banding and they'd had similar rapid weight loss, gastric banding. They'd lost over 100 pounds and their neck and their jawline needed restoration at an early stage. So that was just basically stretched out, loss of volume, laxity, restorative surgery. With Ozempic, we're seeing similar phenomena, but I don't know. What are your thoughts? What are you doing with these patients before they get sent out to a surgeon?
Are you sending them to us?
Yeah, actually, I have.
She does. So we collaborate. But tell us about.
Well, I think it's like
before the surgery.
Tell us how you manage the patients with some of the hollowing that you're seeing with Ozempic face.
So it's sort of like when I say to a patient who's had, been pregnant and now all of a sudden they've got this excess skin, they need a tummy tuck. Well, your face also, as you age, especially if you've been overweight for years and you have excess fat in your face, and then all of a sudden you go and you lose the fat in your face, plus you're aging and you lose the collagen, it's going to hang, not as much as it would on your stomach, but so.
More so in your later years too.
Yes, and so I always tell people that, surgery is the gold standard. Obviously, if you want to go like this, everybody wants to go like this. Well, that's a facelift. But if you're not ready to get there yet, I always say, we were talking about this earlier, you want to preserve your muscle and preserve your collagen. So how can you do that? So number one, diet. So make sure that if you are on a, weight loss plan, or if you're watching your calories, you have to make sure you're getting enough high quality protein, number one. Number two, I used to be more, skeptical of collagen peptides, but now I actually think it's worth taking. So collagen peptides daily. I used to think, well, how's that working, that you're taking collagen, it's going to turn into collagen. But actually, your gastric acid won't break down all of the collagen, and you'll still be able to absorb some, which could potentially help build collagen. And I don't see a downside to it. So collagen peptides. Then we look at, and I'm sure you guys do them here as well, things like microneedling, which can encourage you to stimulate some collagen build, and then some of the fillers and biostimulators to try to help with collagen. Genetics, I mean, some people are lucky. They just have, we can tell, like, isn't it interesting when you do like a cannula procedure on a patient, you can tell people that have stronger versus weaker collagen network in their face. And then, I guess there's like the lasers that can also help. There's all these like little baby things that you can do. And then eventually you just gotta, pull it up.
Exactly.
Tighten it up.
What other, you wanted to talk about that eye thing?
I was going to talk about any hacks. I mean, everyone's looking online for what else can I do? What other, like there's red light therapy. I was just, when we started the podcast, I moved my clipboard a little further away, and you said, well, there's something for that. There's a drop. Like, how do we find these things? How do we learn about these things? And what do you know that you can share with us?
Well, on a recent episode of my podcast, Getting Savvy, I had an optometrist on, and I was talking about a new product I saw that just got FDA approval. So as I've mentioned, it's inevitable that we lose collagen as we age. It's also inevitable that we get a condition called presbyopia, where we can't see up close. So all of a sudden we're start to do this. And you can always tell when someone's at a restaurant their age, it's a giveaway, right? Because they're doing this. So, and you don't want to bring your readers to to a restaurant and put them on. And so there's a new drop now called Viz, or that's the brand name of it. I forget what the...
Over the counter?
No, it's by prescription. Okay. And it's a drop you put in each eye and it constricts your pupil. So the pupil is that black part in your eye. And so it lets in less light. And apparently it helps for about 8 to 12 hours with presbyopia, and it doesn't affect your far vision either. So it sounds like a miracle drug. That being said, I'm sure there are side effects that we'll hear about. I think it can cause some headache and problems with night vision. But, you have to just keep aware of what's out there.
It's very interesting.
Yeah, that's interesting.
And it might be one of those things that you don't use this every day when you're just sitting at home and you can put on your reading glasses, you don't care. But maybe when you're going out,
Yeah, but God did that on purpose. He made your vision go as your looks went, right? So
I totally agree with that. Okay, there's certain things that it's like maybe we're meant to not see as well, so you don't notice all the up close changes.
Exactly.
Maybe you're not meant to hear as well, so things don't bother you.
What other hacks do you have? Okay, so collagen. What about red light therapy?
I haven't bought into red light therapy, but some people again swear by it. It's one of those things. It's not going to do any harm. The initial study on red light therapy, or the initial talk, was that there was these astronauts in space and they had red light therapy to grow plants. And they noticed when they were putting their hands in the red light, their hands seemed to look younger. Okay, so maybe it works. And if you have, it's pretty easy to buy the red light and you just put it in front of your face for 10 minutes, or you buy one of those masks. It's not going to do any harm.
Have you done it?
I have. I've dabbled in it. I'm not great at
commitment to something like that.
How about you, Nancy?
Yeah. Yes, I bought it and I haven't used it for about a month.
Nancy likes to tell me that we should get everything at my clinic so that she can use it. I just want to try it out.
Well, if I was a bed, so they have them attached to a bed where you can put the red light therapy and you lay under it. Then I think I would do it like that as a relaxation treatment, especially if someone was giving me like a facial massage at the same time, doing something.
It is hard to sit upright in front of something daily.
Yeah.
And the commitment to that, yes.
Yeah.
What about other vitamins?
Tell us what you guys do for workout. You're both looking fit. Tell the audience how old? You're 40s?
I am.
And you're how old?
50s.
50s? Okay.
Yeah,
so you both are fit. So tell us what you do to stay fit.
So for me, my general breakdown, first of all, I'm not obsessive about it. I think is number one. Number two, my general breakdown is I like to try to do something higher intensity about 3 times a week. So
cardio?
Yeah, but usually it's like I've been playing tennis lately, and I play singles tennis, which is a workout. It's not just doubles where you're standing there. So that, and then I like to do some zone 2 exercise, like a long walk, usually about twice a week. And then I do Pilates once a week. And then, as most people know from coming to visit my cottage or spending time with me, I don't sit down a lot. I'm just very active in my daily life. So we'll be at the cottage. Am I doing a workout? No, but I can't just lay on the chair. So I'm always doing lifting my body up or doing a plank or doing handstand. I'm always just doing stuff like that. And then I pay attention to my nutrition. I don't
pay attention to your steps.
Nope. I don't use any wearables because some people are really into them. And if it helps you keep on track with your lifestyle plan, that's great. But for me, I was making fun of a girlfriend of mine the other day who's has this new thing, and she's like, it's amazing. It tells me if I got a good sleep. And I said to her, don't you know if you got a good sleep?
Yeah.
I'm with you.
I'm with you on that.
I don't know.
And there's not much you can do about it if you had a bad sleep. And you just hope for a better one the next night.
And then, she's like, the steps. If I'm sitting down in my office all day, I know I haven't got a lot of steps that day.
That's
so
funny.
Yes, I'm going to try to do something later.
I actually don't wear my watch when I know I'm not going to be active that day because I don't want to know. I already know.
And the other thing with the steps too, steps, a step isn't just a step. I get so many patients that come into my office, they're like, I walk 10,000 steps a day. And I look at them like,
yeah, I agree with you.
What are those steps looking like?
Exactly.
And I always tell people, take your heart rate.
To the fridge and back, maybe.
Yeah, and also take your heart rate during those steps. Because if you're not in zone 2, if you're just if your heart rate hasn't really increased and it's just a zone 1
What is zone
workout,
2?
So zone 2 is if you take your maximum heart rate. So your maximum heart rate is 220 minus your age. So if you're 50, it's 170. Okay. And then you want to be, I believe zone 2 is between 50 and 70% of that heart rate. So you want to look at 220, 50% is 110. Okay. So you want to be at about a pulse rate of about 110 to at least be entering into zone 2. So most times if you're just walking around, you're strolling, you take your heart rate, you're still at 80, that's not a step.
So that's good to know. So people don't have to necessarily count their 10,000 steps a day.
And then there's other things I often paddleboard or I go on a Hobie Cat, is that a step? No, but it's just as good as a step, you know?
Okay, well, I think that's a wrap. Thanks so much for paying attention to our podcast at Unfiltered. And I think we really covered a lot of territory today. And I'm sure we'll have Melissa back at another time. Thank you.
Thank you.